There is a common plant that works on the exact same biological pathway as the world's most popular hair loss drug, but without the FDA warnings for persistent sexual dysfunction. Research from the 1980s proved it could block the hair loss hormone, more than a decade before the drug even existed. And in Germany today, doctors prescribe it and insurance companies pay for it. This natural remedy costs less than $150 for a year's supply, while the patented drug can cost over $1,200. For centuries, Seminole tribes in Florida used this plant as a sacred tonic for male vitality. But today, it's just called a supplement, and your dermatologist will likely never mention its name. This remedy wasn't ignored because it didn't work. It was ignored because it can't be patented. Before we expose the 4 decades of research that were buried, if this kind of knowledge is important to you, there's a simple way to protect it. Subscribe to this channel and help us make sure this information finds everyone who needs to hear it. The story of this plant isn't one of accidental neglect. It's a case of deliberate burial. We are talking about the berry of the saw palmetto, a small palm tree native to the wetlands of Florida. For decades, a growing body of scientific research pointed to its ability to block the very hormone responsible for hair loss. Yet this knowledge was not championed, it was sidelined. This happened because saw palmetto exposes a fundamental flaw in our modern medical system, a system that has become brilliant at inventing profitable solutions, but dangerously inept at recognizing effective ones that can't be owned. The suppression wasn't the work of shadowy figures in a secret room, it was the predictable outcome of a system driven by economics, not outcomes. A pharmaceutical company can invest $1 billion to develop a synthetic molecule because a patent grants them 2 decades of exclusive, high-priced sales. There is zero financial incentive to spend that same money proving the effectiveness of a plant that anyone can grow, harvest, and sell. Saw palmetto never stood a chance, not because it was weak, but because it was free. It couldn't be captured by a patent, so it was left outside the fortress walls of mainstream medicine. This created 2 parallel realities that exist right now. In Germany, doctors prescribe saw palmetto extract and insurance companies cover the cost, recognizing it as a valid medical treatment for conditions driven by the hair loss hormone. Yet in the United States, it was quietly removed from the official United States Pharmacopoeia, where it was once listed as a legitimate medicine. It has been legally recategorized and pushed into the shadows of the supplement aisle, where its sellers are forbidden by law from even mentioning what the research clearly shows it can do, leaving millions of people unaware that a credible option even exists. This transition from recognized medicine to fringe supplement wasn't a random event, it was a strategic demolition. A series of regulatory and marketing decisions, culminating in the late 1990s, effectively erased over a century of medical knowledge from the public consciousness. To understand how a plant once endorsed by the American Pharmaceutical Association became an industry secret, we have to go back in time, to a period when the wisdom of the natural world and the practice of medicine were still one and the same. The evidence of what we lost is waiting there to be rediscovered. Our journey doesn't begin in a modern laboratory. It starts in the humid wetlands of Florida, thousands of years before the United States even existed. The Seminole and Miccosukee tribes didn't just live there, they thrived, and the saw palmetto berry was a cornerstone of their resilience. Archaeological sites reveal its seeds were a staple food, a dense source of calories and fatty acids that sustained them through hardship. But it was more than just food, it was medicine. Tribal healers created a tonic from the berries to address urinary issues and support male vitality, recognizing a connection between this plant and the very essence of masculine strength and vigor. This indigenous wisdom didn't stay hidden in the swamps forever. It eventually caught the attention of Western medicine. In the 1870s, a physician from Savannah named Dr. J.B. Redd began documenting his observations, noting the berry's remarkable effectiveness for men suffering from prostate and urinary conditions. His work wasn't dismissed as folk medicine, it was embraced. By the early 1900s, saw palmetto was no fringe supplement. It was a legitimate, mainstream treatment listed in the official United States Pharmacopoeia and the National Formulary, prescribed by doctors and dispensed by pharmacists across the country as a recognized medical solution. Half a world away, and 1,000 years earlier, another culture had made its own profound discovery about restoring hair. In China, During the Tang dynasty around 812 AD, the legend of He Shou Wu was born. The story tells of an old, frail man named Mr. He who discovered a root that restored his vitality and turned his gray hair back to black. That root, known as FOTI, became a revered tonic in traditional Chinese medicine, documented in classic texts for its power to nourish the kidneys and the blood, which were believed to be the direct source of hair's health, color, and thickness. The pattern of discovery repeats itself across cultures and continents. In ancient Europe, the Greeks and Romans were documenting the power of another plant, horsetail. The first century physician Dioscorides described its use in his foundational text, De Materia Medica, not for hair, but for healing wounds and stopping bleeding. They didn't know about silica or collagen, but they saw its powerful ability to repair and rebuild the body's tissues. They were unknowingly harnessing one of the key minerals required to construct strong, healthy hair from the inside out, completing a puzzle that spanned the entire globe. These were not isolated coincidences, they were echoes of the same truth, discovered independently by different peoples facing the same challenges of human survival. The Seminoles in Florida, the herbalists in Tang Dynasty China, and the physicians in ancient Rome all learned to listen to the natural world. Through centuries of observation and trial, they identified plants that supported the body's fundamental systems of vitality, regeneration, and strength. This collective knowledge, earned over millennia, formed the bedrock of medicine, until a new system arose that valued what could be patented far more than what had already been proven. For centuries, this was dismissed as folklore, the wishful thinking of ancient peoples. But modern science, when it finally decided to look, found something startling. The wisdom wasn't superstition, it was observation. Researchers began to uncover the precise biological mechanisms that explained what these cultures had known all along, proving that the Seminole healers and the Chinese herbalists weren't just guessing. They were practicing a form of biochemistry that we are only now beginning to understand. The evidence isn't hidden in ancient scrolls, it's published in peer-reviewed scientific journals, waiting for anyone willing to connect the dots between the old world and the new. The secret to saw palmetto lies in its ability to target the root cause of male pattern baldness at a molecular level. Scientists discovered its lipid extract is rich in fatty acids and phytosterols, which work to inhibit an enzyme called 5-alpha reductase. This is the exact enzyme that converts testosterone into the far more potent hormone DHT, the primary trigger that shrinks hair follicles and stops them from producing hair. In essence, saw palmetto acts as a natural guardian for your hair follicles, reducing the amount of DHT in the scalp, which is the very same mechanism of action as the billion-dollar pharmaceutical drug, finasteride. This isn't just a theory, it has been tested head-to-head against the leading drug. A landmark 2012 study published in the International Journal of Immunopathology and Pharmacology directly compared saw palmetto to finasteride in 100 men over 2 years. While the drug was more potent, with 68% of users seeing regrowth, the study proved that saw palmetto was undeniably effective, as a remarkable 38% of the men taking 320 milligrams of the natural extract experienced a significant increase in hair growth. This was clinical proof that a natural berry could produce a measurable, positive outcome without the drug's severe side effect warnings. The evidence doesn't stop with a single study. It's a growing body of research. A comprehensive 2020 meta-analysis published in the journal Skin Appendage Disorders reviewed all the existing credible studies on saw palmetto for hair loss. The conclusion was clear and consistent, showing positive results across the board with measurable improvements in overall hair quality, total hair count, and hair density. This wasn't a fringe result from one lab. It was the conclusion of a systematic review of the entire body of evidence, confirming that the plant the Seminoles used for vitality was indeed protecting hair follicles. Meanwhile, researchers investigating the Chinese legend of He Shou Wu discovered that its active compound, TSG, appears to work on a completely different pathway. Studies published in the Journal of Ethnopharmacology suggest it helps promote hair growth by upregulating key genes that signal the hair follicle to enter the anagen, or growth, phase. It essentially encourages the hair to start growing and stay in that growth phase longer. It is important to note, however, that the ancient wisdom of proper preparation is critical, as modern case reports have linked improperly processed FOT to a risk of liver injury in sensitive individuals. The Roman and Greek use of horsetail for tissue repair also found its modern explanation under the microscope. Scientists confirmed that horsetail is one of the most concentrated sources of silica in the entire plant kingdom, containing up to 25% of its dry weight in this crucial mineral. Silica is an essential building block for collagen, the primary structural protein that gives your hair its strength, elasticity, and integrity. The ancient physicians didn't know the names of these compounds, but they saw the results. They saw how the plant helped the body rebuild itself from the inside out. This observation was validated in a 2012 randomized, placebo-controlled study on a supplement containing silica from horsetail. The results, published in the Journal of Clinical and Aesthetic Dermatology, were statistically significant. After 180 days, the women taking the supplement showed a clear increase in hair thickness and a measurable reduction in shedding compared to the placebo group. This provided modern clinical proof that supplying the body with these fundamental building blocks, as recognized by ancient cultures, directly translates into stronger, healthier hair, confirming what the Romans had observed 2,000 years earlier. These discoveries are not separate, isolated facts. They are pieces of the same puzzle, solved independently by different cultures across thousands of years. The Seminoles identified a hormone blocker, the Chinese herbalists found a growth phase promoter, and the Roman physicians documented a structural building block. Modern science has now provided the language to explain how they all work, confirming that nature contains a sophisticated and coordinated system for preserving hair health. The question then becomes, if the evidence for these natural solutions is so clear, why was it all pushed aside for a single, patentable drug with a long list of side effects? The answer isn't hidden in a conspiracy. It's written in the logic of our modern medical system. The decline of saw palmetto wasn't an accident. It was an economic inevitability that began with the rise of synthetic drugs. The real turning point came in 1997, the year the FDA approved a new synthetic molecule called finasteride, which was then marketed under the brand name Propecia. This single event created a tidal wave that would wash away a century of botanical knowledge, replacing a natural remedy that had been used safely for generations with a patented pill that came with a devastating hidden cost. Follow the money. The answer is always there. The global market for hair loss treatments is now worth over $4.1 billion annually, a financial empire built on patentable products. You cannot patent a palm tree berry, meaning there is zero financial incentive for a company to spend hundreds of millions on the massive clinical trials required for FDA approval. But a synthetic molecule like finasteride could be patented, giving its creator, Merck, nearly 2 decades of exclusive rights to sell it at a high price. Saw palmetto wasn't ignored because it was ineffective. It was ignored because it wasn't profitable enough. Once the patent was secured, the next step was to dominate the conversation. Starting in the late 1990s, a multi-billion-dollar marketing machine was switched on, flooding television screens and magazines with advertisements for Propecia. It was framed as the one and only scientifically proven oral solution for hair loss, a message relentlessly pushed on both doctors and the public. Against this corporate giant, the humble saw palmetto berry had no marketing budget, no celebrity endorsements, and no voice. The battle for the public's perception wasn't a fair fight. It was a corporate takeover of the narrative. The final blow came not from a marketing campaign, but from a change in the law. The Dietary Supplement Health and Education Act of 1994 created a rigid legal wall between drugs and supplements. Since hair loss is classified as a medical condition, the makers of saw palmetto were now legally forbidden from telling you it could treat hair loss, even though the science showed it worked on the exact same mechanism as the approved drug. This single piece of legislation effectively gagged the competition, pushing a proven remedy into the shadows of the supplement aisle where it could only speak in vague whispers. This left men with a terrible choice. The substitute for the natural berry was a pill that, while effective for many, came with an official FDA warning for severe and persistent side effects, including erectile dysfunction, loss of libido, depression, and even suicidal ideation. An entire community of men suffering from post-finasteride syndrome now exists, their lives permanently altered by a drug they were told was their only option. They were trading their hair for their health, a devastating bargain they might never have considered if a safer alternative, backed by decades of research, hadn't been systematically erased from the conversation. This systemic ignorance is self perpetuating, beginning in the very places we trust most. Medical schools and continuing education programs for doctors are heavily funded by the pharmaceutical industry, so dermatologists learn an immense amount about patentable drugs like finasteride and minoxidil, but next to nothing about clinical phytotherapy. They aren't hiding the information, they simply were never taught it. This creates a blind spot in modern medicine, a system brilliant at selling its own inventions, but tragically incapable of recognizing solutions that grow freely from the earth. Ensuring this cycle of forgotten knowledge continues with each new generation of physicians. But this forgotten knowledge has a stubborn way of surviving. It wasn't erased, it was simply outshouted. It survived in the German pharmacies that still dispense it as medicine. It survived in the scientific journals that publish the data for anyone willing to look. And it survived in the very soil of the Florida wetlands where the Seminole tribes first understood its power. The system didn't destroy the truth. It just built a fortress of patents and marketing around it, hoping you would never look over the walls. Now you have, and you can't unsee what you found. The choice you were offered was never the only choice. It was just the most profitable one. You were presented with an expensive synthetic pill that could cost you your health, while a natural berry, validated by both ancestral wisdom and modern clinical trials, was quietly pushed into the shadows. This wasn't about medicine, it was about market share, a business decision that has impacted the lives of millions. But the story doesn't have to end there, because their patent doesn't give them ownership of the truth. Remember this, the world's oldest pharmacy doesn't have shelves, it has roots. This information is not meant to stay here, it's meant to travel. Every person who learns about this is one less person who can be trapped by a system that prioritizes profit over solutions. Sharing this video isn't just about helping a channel, it's about arming someone you know with knowledge that has been deliberately withheld. If you believe this kind of information deserves to be heard, subscribe and become part of a community dedicated to rediscovering it, ensuring these stories are never buried again. The conversation they tried to silence is starting again, right here. Your journey doesn't end with this video, it begins. Look for the studies we've mentioned, find the peer-reviewed data, and see for yourself. If you choose to explore this path, seek out a standardized leposterolic extract of saw palmetto, the form used in the clinical trials, and always speak with a healthcare professional who is open to discussing all options, not just the ones that come with a prescription pad. There is an entire world of forgotten medicine waiting to be rediscovered, and in our next investigation, we will uncover how a simple kitchen spice is challenging a multi-billion-dollar industry. Don't miss it.